This week, President Trump told pregnant women to avoid one of the few pain relievers their doctors say is safe. As I'm recording this, my wife is 40 weeks pregnant, and here's why this news from Trump is fucking embarrassing. I'm Zachary Oren Smith, and our baby girl could drop at literally any minute. We can't wait. Pain management during pregnancy is something that we've talked about quite a bit over the last 40 weeks. And I think you need to understand why her doctor and the rest of the medical community, including some of the sources that Trump cited, recommend pregnant women use Tylenol to manage pain and fever. The largest study ever done looked at 2.5 million births. When researchers controlled for family factors, they found zero link between Tylenol and autism. Given the importance of a healthy pregnancy, clinical advice in this space gets evaluated and challenged pretty often, the scientific process. In fact, just this year, a clinical perspective reviewed studies in the space finding, again, that when controlling for family factors and selection bias, the connection between acetaminophen, the active ingredient in Tylenol, and autism weakens. It said the current level of evidence does not warrant changes to clinical guidelines for treating fever and pain during a pregnancy. The research has not proven that there is a causal link between Tylenol and autism. But instead of explaining to the American people the difference between correlation and causation, the White House Googled around and pasted anything they could find that backed their cause. The White House pointed to a Harvard review that wasn't new research and just reviewed existing data. The American College of OBGYNs called Trump's announcement, quote, highly unsettling because it wasn't based in reliable data. Autism Science Foundation President Allison Singer pointed out that no new scientific data was presented. Instead, President Trump, quote, talked about what he thinks and feels without offering scientific evidence. Importantly, even the authors of this study the White House trotted out recommended judicious acetaminophen use as, quote, important for treating pain and fever during pregnancy. Ask a pregnant woman about what it's like dealing with and regulating a body that is changing rapidly. Ask experts about what untreated fever during pregnancy can cause. Miscarriage, birth defects, premature birth, and I get the suspicion. I don't like big drug companies either. In fact, Advil and its active ingredient ibuprofen is specifically not recommended for use in pregnancy. It increases the risk of miscarriage, premature birth, low amniotic fluid, birth defects, and delayed fetal growth. All really bad things. Acetaminophen, on the other hand, is among one of the few over-the-counter fever reducers that are safe for pregnant women, period. And so if you're pregnant and have questions about pain or fever, talk to your doctor. They're a great source of information. And maybe skip the press announcements from the White House. It's fucking clown shoes over there. This video comes pregnant wife approved. If you like this story, subscribe to my podcast, cornholechampions.substack.com. For Iowa Starting Line, I'm Zachary Oren Smith. Thanks for watching.